Hi, I'm Dr. Allana Coffee. Thank you for joining me for another interview of Bamboo and Tea with Dr. Allana Coffee. We're outside again, as you noticed from the last of our series of these interviews. We've been outside to keep ourselves safe at this time, where we can socially distance and have a face-to-face conversation at the same time. So thank you for your patience with things like chimes, chickens, airplanes. It's all going down. And we're just going to talk right through it. So hang in there with us as we do so. I'm excited right now to introduce you to a man that I've just met recently, and his name is MacArthur Flournoy the Fourth.
Yes.
There's an H in there. I hope you tell
Yes,
me about
there
it.
is.
But you know, and Mr. Flournoy is working as a chaplain with the Institute for Human Services, IHS, and that's also how I met him, because he works alongside with my husband drcoffee, and they do some amazing and very important work here in our community with folks who find themselves houseless and homeless. And so really allow me to introduce you to MacArthur.
Oh,
So
what a
thank
pleasure.
you. Thank you for
Thank you
coming
so
out.
much.
Right, thank you. So I was reading through your resume, and you know, really it seems like you started your career off in California.
That's correct.
Can you talk a little bit about, you know, what did you do there?
Sure. I grew up in a family where my mom is a nurse. I'm the oldest of seven. And so when I was 15, she says, Mijo, my mother's Mexican, my father's black. And so she said, Mijo, you're going to need to have a career. So she took me into a skilled nursing facility and trained me as a certified nurse's assistant. And that's the way I worked my way through high school and thereby began my career in human services. I loved working with geriatric patients. And I just knew I wanted to be of service. The community in which I grew up was beset by crime, violence, gangs, domestic violence. And I would lay in my bedroom in my family's home, and I would kind of talk to God. It was praying, but it was like, this can't be all there is. You know, we had the helicopters flying overhead who were stopping gangs and throwing drugs over our fence. And while people really respected my father, I just saw that the community needed more. And so I became a mental health counselor. I became a chemical dependency counselor. You know, if you stick around a job long enough, they're going to promote you whether you can do it or not. And so,
I know you can do the job. It's very humble.
Thank you. So I went on to become a clinical services director for a day treatment program for women that were living with HIV and AIDS, as well as combating substance use and learning how to retool their lives. From there, I went on to work as a HIV/AIDS pre and post-test counselor, and eventually became the director of prevention for the San Francisco AIDS Foundation at the height of the HIV/AIDS pandemic. And in that capacity, I saw people who were suffering. People who were told on one hand that your life is not valuable, because many were from the LGBTQ communities.
Yes.
And so they were being spiritually violated at church, and that's what I call it, spiritual violence.
Like they're just dismissed as...
They're just dismissed. In fact, I heard one pastor say, who happened to be my pastor at the time, that we need to allow the judgment of God to prevail and to stop wasting money on HIV/AIDS resource and let the disease take its course. Now, he said this, and because I was one of the elders in our church, I heard 2,500 voices behind me say, "Amen, Pastor." What he did not know at the time is that I was HIV positive. I am HIV positive. And I just remember the feeling of isolation. It's feeling like, you know, I have this horrible problem. I'm in love with God, and yet I'm being told that God hates me. And I took a 3-year hiatus from the work that I was doing and just kind of went on a spiritual journey. Didn't go to any church, didn't go to any place that was remotely spiritual, apart from the lake that I lived by in Oakland, California. And I would walk that lake every morning, and I would walk that lake. And one morning I heard what I consider to be the voice of God. It says, "MacArthur, my grace is enough for you. My grace will cover you. My grace will carry you. Whatever you need, I'll be there for you." And I believed it.
Is this, and then you would go on, you actually started studying divinity then, because this is before the Masters in Divinity.
This is before the Masters
Wow,
of Divinity.
okay, right.
And so this was, I had been pastoring already. I had been a missionary in Africa for a year. I just felt like I really needed to understand the Bible. What was it saying? And what I learned is that so much of what we read has everything to do with who we are. It's about the lens and the filters that I bring to my life experience, how I see the world. Someone once said, we don't see things as they are, we see things as we are. And
Yeah, wow.
I learned about the cultural, political, and social implications of those who were called the scribes and what they brought to the text. I learned that in the year 300, that there was a gathering, the Nicene Council, who decided this is canonical, this is Bible, and this is not. And I just began to wonder, who makes that decision?
Oh, wow.
Who
MacArthur.
decides what is holy and what is not holy? When I look at the writings of Audre Lorde, I think that's holy. When I look at the writings of James Baldwin, when I look at the writings of Dr. Martin Luther King,
Amanda Gorman right
Amanda Gorman, oh my
Yeah,
God, prophet of the day.
Yeah.
If we don't understand that she is bringing us pure gospel, gospel meaning good news,
Good news,
then
yeah.
we have missed the mark.
Yeah,
And her life is a representation of good news as I see it.
So my understanding of what it means to be a chaplain is it's very broadly encompasses that which is spiritual, that which is the magic, that which is like supernatural to humans. So it's not necessarily one denomination. It is very broad. And I also hear you inviting people to be engaged in that.
That's right.
And not be passively fed it, but actually engaged in seeing it
Yes.
and making it
Yes.
useful for themselves.
That's right.
Yeah.
That's exactly right. Because we have so many rich experiences. I work with people who are homeless.
Yeah.
One young person comes to mind who lived on the streets from the age of 14 to 19. He turned 20 a couple of days ago. But for 5 years, he was on the streets. And I won't go into the specifics of his life, but he endured significant trauma. He sent me a text a couple of days ago and says, well, I guess I'll turn 20 and it's another birthday where I'll be in my room crying myself to sleep. And I reached out to him and says, would you give me the gift of allowing me to take you to lunch? And so we went to lunch, and it was, I bought him a bottle of cologne and gave it to him in a gift bag. And we were sitting at lunch and we were talking, and he got very quiet. And I could see he started to cry. And I said, what's going on? He said, how did he say it? I feel your love, Mr. MacArthur, but it makes me sad that it's not coming from my birth family or my adoptive family. And what I began to share with him is, look at what you have overcome so far. I mean, I honored what he's feeling, but I wanted to show him, because he said he couldn't identify any strengths in himself. And I had to take his life and say, let me show you what I see.
Yeah.
And look at what you have endured from the age of 14 to 19. You lived through it, and you're here to tell about it.
Yeah.
That is the definition of resiliency.
Borrow my lens.
Yes.
Yeah, see it through my eyes.
That's exactly right.
That is that real, it's this elegant intersectionality between mental health
Yes.
and really spiritual health.
Yes.
Right? This is what you're talking about.
That's
'Cause I
exactly
think,
right.
like in psychology, we're trained to really separate the two out. And I do think that's primarily, appropriate to do. But then we have someone who's trained in both.
Yes.
Right, and really being able to make that present for that young person, right?
And I think, you know, I love the fact that you raise intersectionality, because that is the heart and soul of what I hope to do. I follow the work of Dr. Kimberly Crenshaw. And her work around intersectionality. And I think, you know, whether I'm doing work in the HIV/AIDS community, whether I'm doing work with the United Church of Christ, whether I'm working with Baptists, denomination to me doesn't mean as much as it is the heart of the person. And who are you? And oftentimes, and I think this is particularly true of people of color, we don't fit discreetly in one box. We don't, you know, I always trip over the time they ask me to fill out an application for anything, and they say black, but not of Hispanic.
And you're like, what?
What? I'm half Mexican and I'm half black, and so I play with them. I check off the Hispanic box, I check off the black box, and I check off the other box. But the point is that we don't fit just in one box. And what I try to get people to see is that there are many dimensions of you, and you were never designed to fit into a box.
You know, I hear that in some of my clients, you know, because this has been a really challenging year, right? And, you know, people are like devastated in many ways and seeking more. And then they're going to their spiritual houses. And it's typically the ones of their parents. And they're finding that it's not thoroughly what they want.
That's right.
There's pieces of it missing. And so then they don't go at all. And I'm like, wait a minute. That's, you know, you don't throw out the whole loaf of bread if you got some mold that you don't like on one end. You still cut that off and go do what you need to do. So I think, you know, I will try to sensitize them. You know, you might not find the perfect fit everywhere.
That's right.
It does not mean that you don't pursue this magical part of yourself. You know, don't neglect that part of yourself just because you haven't found a comfortable fit.
That's exactly right, because I think it goes to the heart of the heart of a person, the spirit of a person. Oftentimes there's a disconnect between going to a house of worship and actually experiencing spiritual renewal. You know, as an ordained minister, as a chaplain, I will tell you that I feel closest to God when I'm sitting at the ocean. I'll go sit at the ocean, and I reference her as her. She moves and she has power, and she could overtake you, but she's gentle. She'll wash you and she'll bathe you, but you have to respect her power. She'll allow you to swim in her, but at the same time, she'll hold you afloat.
You better come right.
And that's exactly what I see my higher power. That's how I see God, is that I have reverence for God, but I am intimate with God, and God is intimate with me, and God desires to be intimate with each and every individual. And I know that word God is oftentimes very loaded. Very loaded, because people have experienced abuse under the auspices of God.
Wants you to do X, Y, or Z.
That's exactly right. You know, I've seen child abuse take place under the rubric of God, or domestic violence, slavery. When I traveled to Ghana, West Africa, one of the things I took note of is the slave castle, this huge white structure. And atop the structure is this gorgeous chapel, beautiful chapel. In the basement of this chapel, of this castle, is where they held the slaves. And you could smell the decaying flesh. You could smell the feces.
Oh, wow.
And as you move towards the door, there's a sign above that says the door of no return.
Oh, wow.
And the point that I took from that is that, to me, that castle represents many churches, places that on the surface claim piety, but in the belly of their being, they enslave people. And I see that in some ways religion has done that. And I know some folks may take umbrage with that, but I look at religion as a set of rituals that are done without reverence for the soul of the person. I look at spirituality where you place the priority on the soul and the spirit of the whole person, and there is unconditional love and acceptance.
Oh, wow. So you're separating out religion from spirituality there, and in spirituality, so much is possible, and it's very personal.
That's right.
Whereas in religion, there's this ascribed set of rules and principles, and not to disparage that at all. I don't hear you disparaging it, but I hear you really saying, the spirituality too. This is a different thing.
That's exactly right. It's not either or, it's both and. There are some times where I'll hear a Baptist song from my childhood and I just cry. And it's just,
Yeah.
it is about nostalgia. It is about my ancestors. It is about understanding that this is my cultural way that has been handed to me. I could tell you, Allana, before I went to Nigeria as a missionary, I went to another seminary to prepare me for missions. And the, how can I say this? Well, I'll just say it. You know, the white Christian upper middle class educators that were teaching us how to do mission work in Nigeria, deal with that for a second, would tell us, don't you dare get swayed by the Africans. Now remember, you're going there to convert them, and they're very seductive. So we need you to, you know, maintain your Christianity. And I went, and I was on a tour bus, and I saw a babalao. A babalao is one who collects herbs in African traditional religion. I saw him from that bus, Allana, and I don't know how this may sound, but he looked at me and I looked at him. And I was thinking, I shouldn't be looking at him like I want to know what you're doing. And the only thought that came to my head was, you know this way. As if he was saying to me, you know this way. This is our people's way. And that is when I made a decision to open myself up to study. That's when it began. It's like,
he saw you.
He saw me. And it's so interesting that you should say that, because in Nigeria, whenever a parent is getting ready to correct their child, they will say, see yourself. See yourself.
Take measure.
Take measure. But then it would be also an exhortation. See yourself.
I mean, have some self-respect.
Have some self-respect.
And check in first.
Yes.
Let me give you an opportunity to correct yourself.
That's right.
There's a lot in that statement.
There's a lot in that. It's a loaded see yourself. It's like, I can see you, but do you see yourself? It's almost like when God asked Adam, if you believe in the Old Testament, it says, where are you? Do you think God didn't know where Adam was? But I think it was a question for Adam. And I think and Adam meaning humankind.
Right.
Where are you? That was God's question to Adam, to humankind.
Well, that was you having lunch with this young man. It's like, see yourself.
Yes.
You know, he says, I can't feel that. And you're like, use me. I see yourself in a way.
And I understand that young man. I was that young man. I was that young man who couldn't see myself. I had been told some things and heard some things, but I hadn't yet been in a place where I could actually see myself. And my hope is that the work that we do at the Institute of Human Services, and I see that, is for us to hold up a mirror to our clients, to say, see yourself. Look past the clothes. Look past the dental work that perhaps hasn't been done in decades. But see your soul. See the survivor in you. See the one that has made it through situations that would have otherwise claimed a life. And our people come to us, many with mental health issues, and rightly so. They've suffered severe loss, trauma, and consequently they're dealing with post-traumatic stress disorders. Many come with pain. And that pain sometimes is unbearable, and so what they try to do is anesthetize that pain with substances, self-medicating. You know this. And there's just a lot of wounds there. And what I see us doing at the Institute of Human Services, and what I hope to do as a chaplain, is to enter into relationship with people such that I can help them see themselves for who they really are. Not who they've been told they are, but who they are. And what's more important for me is not that I tell them,
but it's revealed in the process of the relationship.
That's exactly right. That's exactly right.
You know, you have so much, this is a population where, you know, so many people have different, views, and it's not always welcoming or kind. And you're extending so much grace and respect to a population that's already marginalized. And it's in that respect that they can feel that dignity afforded from you to them in that at lunch. Something so simple,
Yeah.
But I want to just reflect on a situation that happened recently, because I think, MacArthur, your focus yes, is on the residents of IHS, and there are
Yes.
many across many houses and institutions.
Yes.
Right. This IHS is a big thing. It's not just one house.
That's
it's
right.
many. But you're also making a real impact on the workers because they get fatigued. They're doing a hard job. And they've done it for a year and a half under the pressure of a global pandemic. And your presence is also buffering and buoying their spirits as well. And there's one situation in particular that I just want to thank you for. And so sometimes people who are houseless are alone at the time of their passing. They pass away while at residence at IHS, and they're not with their families, but they're at IHS. So the people of those homes are kind of like their family, people who work with them and the other residents. So they die at IHS sometimes, right?
That's right.
And you folks just recently had a beautiful service by the sea.
Yes.
And can you talk a little bit about that? Because that was really a lovely thing to do.
Oh, someone said that people may not always remember what you say, but they'll remember how you made them feel. And when I was working with this particular client, he was something else. He was just something else. And I could tell in his day that he was a whippersnapper. But when I encountered him, his heart was supple. He was thinking about, beginning to consider the fact that he may be transitioning soon. And he was conflicted about that. Who of us can say that we're ready for death?
Right.
And that was the question that was put before him. His life presented him with a series of circumstances where he knew that he needed to accept this, or at least entertain that question. And your husband, Jerry Coffey, who's the embodiment of love and acceptance, had been working with him for a while. This man should have gone to hospice, but he wanted to return to the home where Jerry was and the staff were around him for the last 5 months. And there were those who wanted him to be in hospice for his care. Absolutely understandable. But he understood that relationships takes precedence over geography. And so I would go and talk with him. I would go and try to talk with him. He had a hard time communicating. He had cancer of the throat. And his words at times were almost unintelligible. In fact, one time he was asking me for something, and I was like, "You want water?" "No." "You want the nurse?" "No." I was trying to, and all of a sudden he just goes, "Ah!"
Whippersnapper.
Whippersnapper. But 2 nights before he transitioned, I was sitting there with him. And I was just looking at him, and we weren't talking, because really the role of the chaplain is to be with someone. It's the ministry of presence. Use words only when necessary. Oftentimes we're uncomfortable with silence. And so my role is to be with someone in the way that they need me to be with them. And so I was with this particular client, and I was getting ready to go. And I told him, I'm getting ready to go right now. Is there anything you need? And he held out his hand. And I knew that meant it was time for us to pray. And he allowed me to pray with him. And so I prayed, and I got a call 2 days later that he had transitioned in the night. Well, day before yesterday, Jerry, representation of the staff, myself, we went and gathered by the sea. And we prayed, and we sang songs, and we took some intentional time for silence, because I believe the most beautiful thing we can give anyone is our time. And so I invited us while we were there to be quiet, to be in silence. Do you know, Allana, while we were sitting in silence, now his request was to be committed to the ocean, his ashes. While we were sitting in silence, a wave came up and lapped just on his box of ashes. just on his box of ashes. So I thought to myself, I told the group, that means it's time for me to shut up and and it's time for us to get on with it. But to me, the mysticism
Yeah.
of life, the mystery of death, intersect in a way that could be absolutely gorgeous, such that we who are living can take in a deeper breath because we understand all of this is a gift. Tomorrow is not promised. And that's what I see in the lives of the men and the women that I work with at IHS, people who have come through a very rough way. But our Creator has given us the gift of being with them, us being the staff and community of IHS. And I have seen that staff daily we get emails that said so-and-so successfully transitioned. That means they went into permanent housing. I get to hear of those miracles each and every day. And I know that's another person that was taken off the street, but I also reverence the process they went through. It's not just about housing.
Right.
I think the first place you have to move into is here. You have to move into your own house. And after you move into your own house, then it's easier to claim space externally.
You know, Jerry said, hey, you're going to love MacArthur. Oh my gosh, he knows me so well. It's true. It's true. I want you to come back every day. Get us started so we have a good day with just such a wonderful, consistent messaging. And it's so like fluid. And yeah, it's really, thank you. I mean, I could just, you just talk, I listen. And please use your words because they're actually really lovely.
Thank you.
And I do appreciate silence, and you're right, it's hard to do. Well, I'm a talker, but it is hard to do silence. But you're right, our time is precious, and that which we share. But I really have appreciated your words so much today.
Thank you.
And wow, I'm so grateful for the folks that get to sit with you at IHS. And and some of them are the residents, but a lot of them are the staff, and we need each other to do the hard work that we do to buffer each other and buoy each other's spirits. And you have definitely buffered and buoyed mine today.
That's great.
Wow, thank you.
What a pleasure it is to meet you, and thank you for what you're doing.
Oh,
thank you for the space you hold in this world.
Thank you for saying that, and I'm so looking forward to putting this out, and so that people can hear this interview again and again, and take parts of it that they need to take.
That's
and
right.
It may not be the whole thing, but there's some gems in it that they'll be like, that spoke directly to me. So again, really thank you for that. And we're going to just publish it online. So thank you so much.
Thank you so much, Allana. What a pleasure.
I know.
Blessings.
Thank you, MacArthur.
Thank
How's
you.
that, MacArthur? Flournoy?
Yes.
The fourth. Hey, what's the H? What's the H?
Henry.
Hey, Hank.
I like Hank better than Henry.
Awesome. Thank you so much.
Thank you so much.
Aloha, folks.